So for this video, I'm just going to show you how to give a feed to a cat or a dog with a feeding tube in. So the equipment I've got out is I've got an empty syringe, and I'm going to check the tube for negative pressure, which I'll show you in a second. Got a little bit of water to give beforehand. Here we've got the feed, so you'll either be given a diet which is already made up in a bottle, or you might be asked to blend a particular diet with water at home. And then finally we've just got a syringe of water at the end. So first of all, I'm going to check the feeding tube for negative pressure. Just tuck that out. So whenever you're handling the feeding tube, it's good to maintain good hand hygiene. So I've got gloves on. If you don't have access to gloves at home, just make sure you give your hands a very good wash with soap and water. So what I'm going to do is, when I'm with this particular feeding tube, when I'm unattaching and reattaching, I'm just going to do a little kink at the end, just to make sure it's blocked off. So I'll unscrew that. Then I'm going to attach my syringe. I can undo the kink, and what I'm going to do is check for negative pressure. So this is to make sure that we should be in the correct place. So you can see there, I'm pulling back on the syringe, and then it's sort of popping forward again. So that shows that I've got negative pressure, which is good. So I'm going to kink the end and just disconnect that one. Then I'm going to take my syringe of water. So this first one is just to make sure, again, that the feeding tube is in the correct place. So what we're going to do is we're going to give this one reasonably quickly, and we just want to be looking out to see if the patient's in any distress at all. So any changes in breathing, any sort of coughing or spluttering, and that might indicate that the feeding tube is in the wrong place. If you see any of these signs, then don't give the tube feed and just contact your vet. So I'm going to kink that off again, open that. So I'm going to give it about this speed. It's also going to flush anything that has been left in the tube. So that, no reaction. Perfect. So next we're going to go onto the tube feed. So I'm not going to demonstrate all of this feed, because normally we recommend that you give it nice and slowly, sort of over 15 to 20 minutes. What I've done is, if you've got a diet that you've been keeping in the fridge, if you just get it out an hour or so before you need to give the feed, or what you can do is you can draw it up in the syringe, put the little end on, and then just keep it in a bowl of warm water, and that will bring it to temperature as well. There you are. So it's just going in nice and slowly. So normally with tube feeds, before each one we normally offer them some food, just to see if they do want to eat beforehand. And if they don't want to eat, this is normally a nice opportunity for you to just spend some time with your pet, give them some love and attention and some strokes. Sometimes some patients just need a little bit more TLC to make them feel a bit better, and hopefully they'll eventually eat. So I'm just going to stop there with this tube feed, just for this demonstration. So I've kinked the end off again. So this bit's quite important with the kinking, because you don't want any of the food to come back out. And then finally I'll just get my last syringe of water. So this last one is just to flush any food that's left in the feeding tube into the stomach, just to make sure that it doesn't block. That's it. So if at any point you're giving a tube feed, again, if you have any problems, especially with the diets where you're having to blend it, you might sometimes find it might block if it's not blended properly. You should contact your vet and see if they can help unblock it. I'll put that back in. And there you are.